So what is the reason of valves into the veins? There are two kind of blood vessels in our body. First one is called the artery, which carries oxygenated blood from the heart towards the different organs of our body. And the second one is the veins, which carries a deoxygenated blood from the different organs towards the heart. So in artery, because of the pumping action from the heart, there is lots of pressure. So blood travels from the heart towards the different organs, and there is no restriction or no any other mechanism is required. But uh, when the blood travels into the veins, particularly into the leg region, then there is a separate mechanism developed into our body. So let's understand why the valves are developed into the veins. So in lying down condition, if we consider heart area as a 0 millimeter mercury pressure, then at the ankle region pressure is around 15 millimeter mercury. So this pressure is sufficient to push the blood from the ankle towards the heart. But what happens when the patient is standing up? Because of the gravitational pressure, every centimeter approximately 0.76 millimeter mercury pressure increase. So at the time of when we reaches to ankle, the pressure goes up to 90 millimeter of mercury, and this pressure is very high. And with such a pressure and gravitational forces, blood cannot travel back from the foot towards the heart. It's very difficult to travel the blood from and surpasses with such a high pressure. And for that, body has created different mechanism. So let's find out what is a different mechanism to push the blood back from the foot towards the heart. So body has created the multiple valves into the lower limb, and because of these multiple valves, pressure column is fragmented, and that's why overall pressure is significantly reduced at the ankle region. And because of the reduction of the pressure, and second one, there is a pumping mechanism into our leg, that is a foot pump, calf pump and thigh pump. It is activated into the different uh, different activity while we are the walking. See, in this picture I have shown it that while we are stepping up, that's the foot pump is activated, and after that calf pump, and then the thigh pump is activated. And because of this pumping action and these valves, which reduces the pressure, there is a blood can be pumped back towards the heart from the foot region. So there is a special mechanism developed inside the lower limb veins. So now what if these valves fail? Basically these valves are designed for the unidirectional flow. But when this valve fails, it allows a bidirectional flow, venous pressure is increased, and many portion of this blood reflux back into the superficial venous system, and it leads to such kind of gross varicose vein. So these all are the varicose vein, and sometimes this aneurysmal dilatation of the varicose vein also appear, and this all because of the failed valve. So now how to find out such incompetent valves? Color Doppler is the ideal modality to find out incompetency into the valves. Here in the same patients, we have done the color Doppler, and in color Doppler, blue color shows the normal flow, but when there is a Valsalva procedure is done, this is red color flow along the valves. It shows there is a reflux in the junction level. And once the pressure is released, again the blue color flow, there is a normal flow is established at the resting position. So here the vein also dilated, and into the pulse wave also there is a reversal of the flow chain. So these are classical reflux at the saphenofemoral junctions, and by definition, if the reflux is present more than 0.5 milliseconds, then there is a pathological reflux. But obviously with such a gross varicose vein, reflux is going to continue for long time. So now we have seen why the valves is required into the venous system, and what if these valves fail. If the valves fails, then the gross varicose vein develop, and if these valves fail with such a gross varicose vein, then endovenous thermal ablation is the ideal treatment for such kind of gross reflux.